Hello, my name is Margaret Carlson, and I am the Clinical Research Coordinator for the Division of Emergency Medicine at the University of Utah. And I'm excited to talk to you today about a program that we had implemented in our emergency department to screen for patients at risk for substance abuse. I do not have any disclosures to tell. This is my research team that helped out with this project. They are research associates, medical students, and Troy Madison is the PI on this. So a little bit of background introduction. Utah routinely is an offender of opioid abuse with high percentages of substance abuse issues. This provides a big opportunity for preventative measures and implementations for patients and providers. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. It is a comprehensive integrated public health approach for early identification and intervention with patients who have patterns of alcohol and or drug use, which put their health at risk. And so by identifying these early, these could help patients get into treatment earlier to prevent them from having that abuse. The emergency department actually provides a great setting for this as it reaches a lot of patients, a lot of people from different populations, and is a way to easily funnel them into care quickly by having everything in one spot. Even though this is a great opportunity for prevention and intervention, we wanted to look at whether providers were aware of this abuse, and if they weren't aware, what we could do about that. So the purpose of this was to analyze the data that we have from this program to see how many patients were at risk for substance abuse, and then in which from those patients were the providers aware of their patient's risk. So the method that we used is we implemented this program into our ED utilizing our advanced research associates to approach patients during their ED visit. About 80 hours a week, they administered the assist and audit screenings. Those that screened moderate to high risk for substance abuse were offered treatment resources and the opportunity to talk with social work during their stay that day. And then the treating providers for these patients were informed of their patient's risk. When we talked to the providers, we also noted whether or not they were aware of their patient's risk prior to us coming to them, as well as a couple other questions. So this is one thing that pops up for the SBIRT program. It just shows the drink amount for patients to help them identify how many drinks they've had. This is an example of a report after the SBIRT has been administered, and this shows that the patient suggests a moderate risk for health issues. And then this shows the score of lower to moderate to high risk, and as well as all the practices and substances that we talked about. So through the results, over a 1-year period, about 5,000 patients were participated. About 170 of them screened moderate to high risk for substance abuse. And these are the top 4 substances and abuse risks. So cannabis was the highest, followed by alcohol, followed by methamphetamines, and then opioids. We combined prescription and street opioids for that percentage. Of the patients that screened moderate to high abuse, we talked to 85% of those providers, and the providers were unaware of their patient's substance abuse 43% of the time, which is very high. These patients wanted treatment, they were interested in having treatment resources, and a majority of them were actually discharged from the emergency department that day. Some of the cases, a majority of the cases, the provider agreed or strongly agreed when we talked with them that they would discuss the SBIRT results with the patient going forward to discuss treatment, discuss the results, and lifestyles going forward. So with this, SBIRT can aid in actually addressing substance use disorders through this direct intervention process and having the provider aware of their patient risks. And this could eventually help with patient habit care and then care going forward, and they're addressing risk of substance abuse disorders. In conclusion, through this program that we implemented, we found that the treating provider was unaware of the patient's substance abuse a large majority of the time, and many of these patients were actually interested in treatment resources. And so this suggests the potential for a program like this to identify at-risk patients, and then beyond that screening process, help educate providers as well on their patients' risk numbers. If there are any questions or comments, please feel free to contact me at my address there, or the PI on this, which was Troy Madison. Feel free to contact him as well. Thank you. And I hope you enjoyed this presentation.